calls you.
And then you say,
And then I stand.
okay, so what's that saying about you?
That I'm doing my job.
You did use all this.
You good? No? Okay. What happened to your hand?
I broke a bone in it.
Oh,
I know. Not a great.
It's a horrific accident. Can you tell everybody about it? Can we-
Playing with my kids on a trampoline.
30,000 people.
yeah, don't talk to me about those. Okay, good? Okay, great. All right. Good afternoon, everybody. Today is Wednesday, May the 6th. I am Dr. Val Arkis, Chair of the Montgomery County Board of Commissioners. I am here with Commissioner Ken Lawrence, Dr. Al Wong, Regional EMS Director, Dr. Brenda Weiss, Administrator for our Office of Public Health, and I want to thank Megan for interpreting for us. Since our press briefing yesterday, we have had 123 new cases of COVID-19 in Montgomery County, which brings us to a total of 4,734. Now, of these 123 new cases, 77 are from long-term care facilities, and the majority of these 77 results are from 2 facilities that have conducted testing of most or all of their residents. These positive individuals are from 25 municipalities, none of which are reporting new cases, so this keeps us to 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 1-year-old to 103 years old, and as always, you can check our county map at montcopa.org/COVID-19 for an updated municipal map. Today, there are 75 females and 48 males. 5 are known to be hospitalized. 7 are known to be at home in isolation. We have the 77 individuals from the long-term care facilities, and then the remainder are people we do not have information about. Sadly today, I can confirm that 26 more Montgomery County residents have lost their lives to COVID-19. This brings us to a total of 379 deaths confirmed positive from COVID-19. Again, because this is a larger number than we've reported on other days, I will tell you that the date range for these 26 individuals ranges from April 13th to May 6th, and that 16 of these deaths did occur in the month of April. So again, just another example of how long it takes sometimes for all of the information to come together in a way that we can confirm it and report it to you. We have information that 5 of these individuals died in a hospital, 7 died in a residence, and 14 we do not have information on. They ranged in age from 62 years old to 102 years old. So far, during this pandemic, 204 females and 175 males have lost their lives to COVID-19. The self-reported racial breakdown is as follows: 12 Asian, 3 Asian Indian, 3 Asian Korean, 33 African American or Black, 103 white, and 225 we do not have information about. In terms of probable deaths, and as a reminder, these are individuals who have COVID-19 listed as a cause of death on the death certificate, but do not have confirmation from a lab that that was the cause of death. Now, some of these individuals we do end up getting lab confirmation later, and then we move them up into the confirmed positive count. So today we are at 162 total probable deaths. Adding that to our confirmed total, That is 532 total individuals. Our hospital beds continue to hold stable. As of right now, we have close to 400 patients hospitalized across Montgomery County hospitals, about a quarter of which are on ventilators in intensive care units. But thankfully, thanks to all of your good work and sacrifices, we continue to have hospital beds available in all of our county hospitals, both regular beds and intensive care unit beds, and we do have enough ventilators available. So this continues to be a bright spot in this fight. Today's update on our long-term care facilities: we have 91 facilities that are reporting positive cases of COVID-19 in their residents or staff. We have 1,274 cases among residents, 511 cases among staff, for a total of 1,785 individuals. Not all of these individuals are Montgomery County residents, so just a reminder that those numbers do not roll up in any way to that big number that I told you at the beginning. But again, it's our daily snapshot and reminder of how hard so many people are working in our long-term care facilities to keep these residents safe, and just a daily reminder of some significant challenges in these facilities. 310 of our 379 confirmed positive deaths of Montgomery County residents are individuals who were long-term care facility residents. That is 82% of our total confirmed positive deaths here in Montgomery County. We continue to do outreach to these facilities. Our Field Assessment and Support Team, or FAST team, as of the end of yesterday, had visited 48 facilities and had 12 visits planned for today. I sat in this morning on a debrief from some of these visits, and they continue to go well. There continues to be many questions that are answered during these visits. The visits have gone smoothly and have been very positive experiences for everyone involved. The team wanted me to convey to all of you how sad so many of the workers are at these long-term care facilities, as they have lost individuals that they have cared for, in many cases for years, and how frustrated and disappointing so many of them have been, as they have tried very, very hard to keep this virus out of their facilities. But as we know, this virus is very treacherous and very contagious, and obviously they have not all been successful in doing that. But they continue to welcome us to their facilities. We give advice on infection control, how to handle personal protective equipment, just mostly answer a lot of questions, and continue to connect these facilities to resources. So we're happy to see, and we showed this yesterday, that the numbers are starting to come down in these facilities. The situation at our Montgomery County Correctional Facility remains stable. All inmates, the 171 who tested positive when we did our mass testing, remain asymptomatic as of this morning, and are remaining in isolation. Our community testing sites are both up and running today and doing well. Just for a reminder, the Norristown walk-up testing site is open Mondays through Fridays from 11 to 1 for testing only at the Delaware Valley Community Health Center, and we want to thank them for the wonderful partners they have been in this work. Appointments for tomorrow, Thursday, can be made by phone only, starting at 8:30 tomorrow morning. That phone number is 610-592-0680. That's 610-592-0680. The Montgomery County Community College site is also open and running smoothly. Thank you very much to Whitpain Township and the Community College, Whitpain Township Police, the National Guard, and all the county folks that are helping out at both of these sites. So the totals from our community-based testing, both sites, from April 16th to May 4th, we've now tested 3,655 individuals. We've received results on 3,457, and that represents 95% of the total. 520 of these individuals are positive. So for the first 16 days of testing, we are running 15% positive, so basically holding steady. Appointments for tomorrow, Thursday, at the drive-through site at the community college will open at 8 a.m. Those appointments can be made online at montcopa.org/COVID-19 under the green County Testing Information button, or you can call 610-631-3000. And again, that's starting at 8 a.m. tomorrow morning. Just a reminder that the Norristown site is closed Saturday and Sunday. The community college site will be open Saturday, but will be closed on Sunday for a safety stand down and to observe Mother's Day. So a couple announcements today. Today is National Nurses Appreciation Day, and it's hard to think of a better time to thank our nurses. At the end of the 19th century, the lady with the lamp, who probably most of you know as Florence Nightingale, founded modern nursing. Thanks to her strict use of hand washing and hygiene practices while caring for wounded soldiers in the Crimean War, Nightingale and her colleagues reduced the death rate from 42% to 2%, ushering in nursing as we know it today. It is just a little bit ironic that something as simple as hand washing made such a huge difference that long ago and continues to make such a huge difference today. With over 3 million nurses working in the United States today, nurses make up the highest percentage of the U.S. healthcare workforce. With other healthcare workers, they also are heroes who are putting their lives on the line every day to help treat patients during this difficult time in hospitals, in long-term care facilities, in personal homes, and in other facilities. And we really honor the incredible work that our nurses have been doing, particularly during this COVID-19 pandemic. As a physician, I was grateful every day for the nurses that I was honored to work with. And if you get a chance and you know a nurse, please make sure you thank them today. And today is also National Interpreter Appreciation Day. Sign language interpretation is a unique and special profession that offers the ability to learn and see things from a new perspective. Sign language interpreters are compassionate friends and fierce allies of the deaf community. And today we want to take a moment to honor and thank interpreters for their commitment to the field and to the communities that they serve. We have been very proud to partner with Philadelphia Area Deaf Hearing Communication Center during this challenging time to ensure that all of our residents get the important information that they need. I want to give special thanks to our interpreters who've been integral to helping us communicate critical and time-sensitive information presented during these press briefings during this COVID-19 pandemic. Today, Megan Maris is with us. Sarah Campbell is here with us also many days, and Brandis Mazik has been with us. So we want to say thank you to all of you for the incredible work that you have been doing. I want to address a very, very important issue that has been bubbling up locally in the community, and that has to do with how we are going to commemorate Memorial Day this year in Montgomery County. Memorial Day honors those who have died while in service to our nation. We owe these individuals our deepest gratitude. In a time-honored tradition, the County Office of Veteran Affairs has marked this solemn holiday by purchasing and distributing approximately 59,000 flags. Now, we have purchased the flags for this year, but we are going to postpone distributing them. In a typical year, these flags would be distributed to 59 organizations that place flags at 212 locations. These organizations include scout troops, church organizations, Rotary clubs, Lions clubs, and VFW groups, as well as many others. Bringing these large numbers of groups together creates the very situation that we have been working so hard as a community to avoid. We had checked to see what others in our community are doing. The Philadelphia National Cemetery issued an alert asking visitors to stay in their cars. family members can visit a graveside but must practice social distancing. The American Legion has announced that they will practice a virtual Memorial Day on social media. They are asking American Legion family members and those outside of the organization to share with them the names of those you will honor and remember on Memorial Day. Their plan is to compile a list and then begin sharing those names regularly via their social media channels over Memorial Day weekend. The county on Memorial Day plans to light our courthouse red, white, and blue and place flags with a mourning ribbon on the courthouse grounds. We will share these images widely via social media. It goes without saying that family members can visit the graves of their loved ones and place flags on Memorial Day. We just ask that if members of different households are doing this together, they wear masks and practice physical distancing at the gravesite. The county's Office of Veterans Affairs is planning to move the placing of the 59,000 flags on graves to the 4th of July holiday, when we believe we will be able to honor the fallen with less risk to the volunteers and to our community. The Office of Veterans Affairs will distribute the flags using appropriate social distancing techniques and plenty of time to let groups prepare for the 4th of July holiday. We appreciate the feedback that we have received on this decision, some of which has been positive, but we fully acknowledge the frustration that has been expressed by some VFW veterans groups. This has been a spring of extraordinarily tough decisions. We have asked businesses to close their doors, religious celebrations to take place over Zoom, high school graduations and weddings to be canceled. We will still honor our veterans who gave their lives in service to this great country on Memorial Day, but we will postpone the placing of flags until the 4th of July holiday. And with that, I will turn over to Commissioner Lawrence.
Okay, good afternoon. Today I'm announcing round 2 of the Montco Strong Small Business Grant Programs. Montgomery County is making available $5 million in economic development funds to provide grants to eligible small businesses for round 2 of the Montco Strong Small Business Grant Program. Grant awards will once again be administered by the Redevelopment Authority of Montgomery County and the Montgomery County Commerce Department. The $5 million available for the second round of the program includes funds from the Delaware Valley Regional Economic Development Fund and the Federal CARES Act. We would like to thank the Delaware Valley Regional Economic Development Fund, chaired by former County Commissioner Tom Ellis, for their support of Montgomery County's small businesses. Updates to the program for round 2 include new eligibility parameters, strategically identified program priorities, and other changes that are being incorporated to make the program more equitable and also ensure more businesses have an opportunity to compete for funding. Changes include a tiered grant award system based on gross revenue, a maximum of 30 full or part-time employees, and a greater emphasis on supporting minority, women, and veteran-owned businesses, and changes in allowable use of grant funds and business eligibility. Any businesses interested in applying should thoroughly review the guidelines to determine their eligibility and prepare to submit an application. The updated guidelines, updated program fact, and additional information will be available on the program website, which is www.montcopa.org/MontcoStrongSBGP later today. And you can also find the program link on our county's COVID-19 Data Hub and the Commerce Department's homepage. Round 2 applications will be accepted beginning at 10 a.m. on Wednesday, May 13th, and the application window will close at approximately 6 p.m. on Wednesday, May 13th. Applicants who applied in round 1 and did not receive a grant will need to apply again in round 2 due to the changes in program eligibility and the new tiered grant award system. Those businesses who did receive a grant in round 1 are not eligible to apply in round 2. And we once again would like to extend our thanks and appreciation to the Redevelopment Authority and their Board of Directors for their continued partnership with us and collaboration with our Department of Commerce. And with that, I'll turn it back over to Val.
All right, happy to take questions. There's a long line.
I want to just get some clarity on what, I know that you have the chart up, but if you can briefly summarize what our numbers look like to remind people of what we need to get into yellow,
Right.
what that may look like without the guide.
Yeah, sure. So the question is if I could sort of review this chart, right, and just talk about where we are with the numbers. Okay. So this chart, which goes through April 30th, so we haven't updated it since yesterday, shows several different pieces of information. The gray vertical bars are the number of positive cases that we have reported here at the county every day. The yellow line at the top is all of those cases put into a 14-day moving average so that you can see over time what that 14-day average looks like. And that yellow, the tip of that yellow line ends right around, I think, about 95 cases per, is it per 100,000? It would just be 95 cases, right. The governor's target for us, and remember, I just want to remind everybody, this number that would move us from red to yellow is just one factor among several that the governor's team will take into consideration to actually move us. But if we were held strictly to just that one measurement, that number's 30. So if you want to know what that looks like, the orange line, which happens to represent the individuals in our long-term care facilities, also on a 14-day average, the tip of that line is right about at that 30 number. So you can get a sense of the difference between the orange and the yellow of where we need to be. The blue line is everyone who we believe, is not at a long-term care facility. And I do want to remind you that we did our best to identify the people from long-term care facilities separated out from other community members. It's difficult because of the way that addresses get entered in when the tests are submitted. Some facilities that are connected with a hospital might use the hospital zip code, and so we have to figure out, was it the hospital or the long-term care facility, things like that. So these numbers aren't exactly perfect, but we believe they're very, very close. So the orange is long-term care, the blue is community, the yellow is the two together. And happily, we've seen that our community numbers peaked back when I told you sort of the end of that first week of April or so, and we've been sort of steadily, very slowly declining. The long-term care numbers started to peak about mid-April. That is when we started hearing more concerns from those facilities. It was shortly after that we started to put together these FAST teams that have now been out and visited by the end of the day today about 60 of those facilities, offering guidance and assistance. And hopefully that seems to be having an impact. Now, what we might see over these ensuing days, and it's why I mentioned it this morning, is one of the pieces of advice that we're giving to these long-term care facilities is to test all of their residents and staff if they're able. So, for instance, today I had a pretty big number, 77 positives from long-term care facilities. 2 facilities make up most of those results because they were testing everybody. So it's just a way for these facilities to better congregate their patients, hopefully keep everybody who isn't positive separated from people who are. The staff now knows who's positive, who isn't, and it will be used as just part of our bigger picture to have a greater understanding of where as a community we're moving.
We talked about, about numbers from the Norristown testing facility. Have you had enough people go through there to be able to determine what your cases look like from there versus the drive-up facility?
Yeah.
If there's any kind of difference?
Yeah, we have had. So the question was about any results from the Norristown walk-up testing site for residents of Norristown. And happily, we've now tested, I think, close to 100 people there, and we are seeing a similar percentage, about 15% positive there as well. Todd?
We have one question that was submitted by an outside reporter. It's from Will Lewis from WFMZ. The question is, what are your thoughts on excluding the long-term care numbers from the total number of cases that Montgomery County reports in relation to any future reopening plans?
So the question is, what are my feelings about excluding the long-term care numbers from our numbers when we are looking at reopening plans? So that is not something that I support, and the reasons are the following. Number one, these are very important members of our community that are in these long-term care facilities. They are our parents and our grandparents, our aunts and uncles and brothers and sisters. Some people are there for decades. Other people are there for a brief time because they're recovering from a stroke or a heart attack and intend to go back home at some point. So it's a group of people that deserve our care and respect. This is also a group of people that will go to the hospital. Some won't, but many will. And in fact, what first alerted us to the situation in the long-term care facilities were calls to 911 asking for ambulance transport of these individuals to hospitals. So when we look at all of the metrics, and that's why I'm asking people not to get so focused on that one number. That is just one aspect of our reopening. One of the other very important aspects is the availability of hospital beds. And so individuals from long-term care facilities do go to hospitals. They do use our first responders to get there. And in all of those cases, we are creating exposure and possible transmission of COVID-19. So we have to take that into consideration. Third, the long-term care facilities are staffed by a lot of very, very hardworking people who go home at night to their families for the most part. And those individuals are in Montgomery County and many of our neighboring counties. And so those people are just coming back into our communities every night. And there is another opportunity there for potential spread. So these are not people that are on some island that are in no way impacting the rest of us. These are people that are part of our community. I think it's completely acceptable to track the trajectories separately so that we have a greater understanding of what's happening in those facilities compared to the larger community, but they are absolutely part of our community and need to be factored in. There needs to be factored in terms of opening, relaxing restrictions. Anything else? No? That's it? Okay. All right, great. We'll see you tomorrow. Thank you.